Have you ever had that nagging feeling, like something inside your body just isn't quite firing on all cylinders, but you can't quite pinpoint what it is? What if I told you that your prostate, a gland vital to men's health, could be silently undergoing changes, even potentially facing a life-threatening condition, and you might not experience any noticeable discomfort until the problem has significantly progressed? It's a sobering reality, but every single day, countless men over the age of 60 receive a diagnosis of prostate cancer at a stage that is far too advanced for optimal treatment. And tragically, this often isn't because they deliberately ignored blatant warning signs, but rather because they were simply never informed about what those early indicators actually look like and how important they are. I'm Dr. Evelyn Blake, and over the course of my career, I've had the privilege of working extensively in geriatric medicine, focusing on the unique health needs of older adults. I've sat across from countless patients, men just like you, beloved husbands, dedicated fathers, cherished grandfathers, who initially attributed their symptoms to the inevitable process of aging, only to later discover they were grappling with one of the most prevalent, and yet often preventable, diseases affecting men: prostate cancer. The unfortunate truth is that this particular cancer often cleverly disguises itself, mimicking harmless age-related changes. Perhaps you've noticed some slight urinary issues, a persistent feeling of fatigue, a noticeable dip in your overall energy levels, or even some mild discomfort in your pelvic region. But these seemingly insignificant changes aren't just random occurrences. They're your body's subtle, yet persistent, attempts to alert you to a potential problem. In this video, I'm going to carefully guide you through the 8 most critical symptoms of prostate cancer, signs that are frequently overlooked by men until it's tragically too late for early intervention. These aren't obscure medical anomalies or exceedingly rare conditions. They are real, common experiences that are shockingly easy to dismiss or attribute to other causes. And importantly, at the end of our discussion, I'll reveal the single most impactful step you can take today to proactively protect your prostate health and, quite possibly, extend your life. So please, stay with me through the duration of this video. This could very well be the wake-up call your health has been patiently waiting for. Now, before we delve into the specific symptoms, if you haven't already done so, I strongly encourage you to subscribe to this channel and turn on the notification bell so that you never miss another important health message specifically designed to address the unique concerns of men like you. And if this video resonates with you in any way, if you find the information helpful or relevant to your own experiences, please type the number 1 in the comments section below. Conversely, if you feel that the video doesn't quite align with your needs or concerns, please type 0. Your honest feedback is invaluable in helping me tailor future content to be even more beneficial and relevant to your specific needs. Let's begin by exploring the very first symptom, one that often goes unnoticed because it seems so commonplace, so easily explained away. But for men over the age of 60, it could represent the earliest, and therefore most crucial, warning signal that your prostate is sending. I'm referring to frequent urination, particularly during the night. So, let's break it down. Symptom number 1. You're finding yourself needing to urinate more often than usual, especially during the nighttime hours. For many men in their 60s and beyond, waking up once, maybe even twice, during the night to urinate might seem like a normal part of the aging process, just another minor inconvenience to accept. But when those nighttime trips to the bathroom escalate to 3, 4, or even 5 times a night, it's absolutely time to stop dismissing it as a simple consequence of getting older. Frequent nighttime urination, also known as nocturia, is one of the earliest and most frequently overlooked signs that something could be seriously amiss with your prostate gland. Here's a simplified explanation of what's happening behind the scenes. As the prostate begins to enlarge, whether due to benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, or the initial stages of prostate cancer development, it starts to exert pressure on the urethra, the narrow tube responsible for carrying urine out of the body. This added pressure makes it increasingly difficult to fully empty the bladder during each urination. As a result, even after you've recently visited the bathroom, your bladder quickly signals your brain again, prompting you to wake up repeatedly throughout the night with the urge to urinate. But it's important to understand that this isn't just about the inconvenience of interrupted sleep or the frustration of multiple nighttime bathroom trips. That constant disruption to your natural sleep cycle can lead to a cascade of negative health consequences, including memory impairments, persistent daytime fatigue, elevated blood pressure, and a weakened immune system, making you more susceptible to illness. More importantly, this frequent nighttime urination is your body's way of communicating that your prostate is struggling and potentially signaling the early development of cancerous cells. Far too many men simply assume that this is an inevitable part of aging and never even mention it to their doctor during routine checkups. But ignoring this symptom could mean missing the critical window of opportunity where prostate cancer is still highly curable with appropriate intervention. So, if you've noticed yourself making increasingly frequent nighttime trips to the bathroom lately, please don't simply chalk it up to coincidence or attribute it solely to the aging process. There's almost certainly more to the story, and further investigation is warranted. And the next symptom we're going to discuss might surprise you even more because it's something you can actually observe with your own eyes on a daily basis. Symptom number 2, experiencing a weak or interrupted urine stream. Now, let's address something that many men experience at some point in their lives, but that few ever openly discuss or seek medical attention for: having a weak or interrupted urine stream. You approach the toilet, and it takes an unusually long time for the urination to actually begin. The flow itself feels noticeably slow, uneven, or it even stops and starts intermittently midway through the process. Perhaps you find yourself standing there for a longer period than you used to, patiently waiting for your bladder to completely empty. You might dismiss it as a minor annoyance or simply attribute it to your body slowing down with age, but in reality, it could be one of the earliest and most subtle clues that your prostate is under duress, literally being squeezed or compressed. As the prostate begins to enlarge, whether from the natural aging process, inflammation due to infection, or the development of cancerous cells, it can start to constrict or squeeze the urethra, the tube through which urine flows. This narrowing of the urinary pathway makes it more difficult for urine to pass through freely and consistently. Imagine stepping on a garden hose while someone is using it. The water will still come out, but it will no longer be a steady, forceful flow. It will be weak, inconsistent, and ultimately frustrating to deal with. That's precisely what happens with your urine stream when your prostate is enlarged or compromised by cancer cells. What makes this particular symptom especially dangerous is how easily it can be overlooked or dismissed as insignificant. Many men simply attribute it to dehydration or assume that they just need to increase their fluid intake. But when the urine stream becomes noticeably weaker than it used to be, or you find yourself straining or pushing to force the urine out, it's a definite red flag that warrants further investigation. And when left unchecked and untreated, this weak or interrupted urine stream can lead to a variety of complications, including bladder damage, urinary tract infections, or, in the worst-case scenario, a delayed diagnosis of potentially life-threatening prostate cancer. So, if you've observed any changes in the way you urinate, particularly if the stream is becoming progressively weaker or more frequently interrupted, it's absolutely time to pay close attention and seek professional medical advice. But as we move forward, I want you to remain especially alert because the next symptom is one that not only disrupts your physical comfort but can also intrude upon the most private and intimate moments of your life. Symptom number 3, experiencing pain or a burning sensation during urination or ejaculation. This next symptom is one that many men find understandably difficult to talk about openly. Experiencing pain or a burning sensation during urination or ejaculation. It's undeniably uncomfortable. It's intensely personal. And for some individuals, it can even be a source of significant embarrassment. But let me assure you of this. If you're feeling a burning sensation when you urinate or during sexual release, it's absolutely not something you should ignore or simply chalk up to the inevitable consequences of aging. When the prostate becomes inflamed, irritated, or invaded by cancerous cells, the tissues surrounding it can become highly sensitive and reactive. That irritation can trigger pain or a burning sensation as urine or semen passes through the affected area. Sometimes, this symptom is caused by a relatively simple infection, such as a urinary tract infection or prostatitis. But in men over the age of 60, persistent pain or burning, particularly if it comes and goes without explanation or gradually worsens over time, could signal something far more serious developing within the prostate gland. Here's what makes this symptom particularly tricky to interpret. Prostate cancer doesn't always cause pain or burning in its early stages. But when it does occur, it's often because the tumor has begun to affect nearby nerves or the surrounding tissues. You might also notice this symptom occurring in conjunction with other subtle changes, such as a reduced force of ejaculation, discomfort deep within the pelvis, or a general soreness that simply won't go away despite rest and over-the-counter pain relievers. Unfortunately, many men delay mentioning this particular symptom to their doctor, hoping that it will resolve on its own without medical intervention. But pain, especially in these sensitive areas, is never something to take lightly or dismiss without proper evaluation. The body is sending a very clear signal that something is amiss and requires immediate attention. If you've experienced this type of discomfort, even if only occasionally, it's definitely time to take action and seek professional medical guidance. Because the next symptom we're about to uncover isn't about physical sensation at all. It's about something you can actually see with your own eyes. And once you do observe it, it's virtually impossible to ignore or dismiss. Symptom number 4, the presence of blood in your urine or semen. Seeing blood where it clearly doesn't belong is undoubtedly one of the most alarming and unsettling experiences any man can face. Whether it's in your urine or your semen, it's a symptom that almost instantly grabs your attention and triggers a sense of deep concern. And rightfully so. The presence of blood in either of these bodily fluids is not normal, especially for men over the age of 60, and it can be one of the clearest and most definitive signs that something is seriously wrong deep within the prostate gland. When cancer begins to form in the prostate, it can irritate or even rupture tiny blood vessels located inside the gland or in the surrounding tissues. This can lead to the presence of blood in your urinary or reproductive tract. Sometimes, the blood is visibly apparent, appearing bright red or rust-colored. Other times, it's microscopic and only detectable through laboratory testing of your urine or semen. But regardless of whether it's visible to the naked eye or only detectable through testing, it's a sign your body is sending that should never be ignored or taken lightly. The biggest mistake many men make is assuming that the blood is simply a result of strenuous physical activity, excessive sexual activity, or a minor infection. They adopt a wait-and-see approach, hoping that the bleeding will resolve on its own without medical intervention. And while sometimes it does temporarily subside, that brief pause in symptoms doesn't necessarily mean that the underlying issue has disappeared. In fact, it may indicate that the cancer has settled in deeper and is silently progressing without detection. I've personally spoken with men who saw blood in their urine or semen on a single occasion and chose not to mention it to their doctor for months or even years. When they finally did seek medical attention, the cancer had already spread beyond the prostate gland, significantly limiting their treatment options and overall prognosis. The critical window for early, curative treatment had tragically closed. That's precisely why this symptom is so crucial to recognize and address promptly. If you ever see blood where it doesn't belong, even if it's just once, please don't hesitate. Speak to your doctor immediately and undergo appropriate diagnostic testing to determine the underlying cause. And if you think that's a serious symptom, the next one we're going to discuss may hit even closer to home because it affects something that most men over the age of 60 already worry about but rarely connect directly to the possibility of prostate cancer. If you're experiencing back or pelvic pain that doesn't respond to traditional treatments and you're also dealing with any of the earlier symptoms we've discussed, such as frequent urination, a weak urine stream, or changes in erectile function, your body may be trying to communicate something far more urgent and serious. Ignoring bone-related pain can allow cancer to spread unchecked, but recognizing it for what it truly is, a potential sign of metastatic prostate cancer, can be the key to catching the disease before it progresses even further. And speaking of subtle but potentially serious changes, the next symptom we'll discuss is one that you won't feel in your bones, but you'll likely see it reflected back at you in the mirror. Symptom number 7, unintentional weight loss and fatigue. When you begin to lose weight without actively trying to, without making any significant changes to your diet, and without increasing your level of physical activity, it's absolutely time to pay close attention to what your body is trying to tell you. For men over the age of 60, unintentional weight loss is never something to ignore or dismiss lightly. It's one of the body's most urgent and concerning warning signs, and it warrants immediate medical evaluation. And in the specific case of prostate cancer, it can indicate that the disease is quietly taking hold and progressing without your knowledge. Prostate cancer, like many other types of cancer, consumes a significant amount of the body's energy as it grows and spreads. It essentially hijacks your metabolism, breaks down muscle tissue for fuel, and often suppresses your appetite, all of which contribute to weight loss that seems to come out of nowhere. You might notice that your clothes are becoming looser, your face appears thinner, or your overall strength is gradually fading even though your daily routines and activities haven't changed. That's not simply a natural consequence of aging. That's your body being gradually drained of its energy reserves from the inside. Along with the unintentional weight loss often comes a persistent feeling of fatigue, sometimes mild and easily dismissed, but often deep and unrelenting. This isn't the kind of tiredness that goes away with a quick nap or a good night's sleep. It's the kind that lingers, making it increasingly difficult to get through your day, leaving you feeling as though you're constantly running on empty. And when this profound exhaustion is combined with other prostate-related symptoms, it's a definite red flag that should never be ignored or taken lightly. Many men mistakenly write these signs off as simply getting older or experiencing the normal aches and pains of aging. But when your body starts shedding pounds in energy without any discernible explanation, it's your immune system essentially waving a red flag, signaling that something is not right and requires immediate attention. And while this symptom might develop gradually over time, the final one we're about to cover is often felt almost immediately. It's frustrating, it's relentless, and it can feel like your bladder is actively betraying you. Symptom number 8, experiencing the persistent feeling that you still need to urinate even immediately after having just gone to the bathroom. Imagine finishing a trip to the bathroom, stepping away from the toilet, and immediately feeling the nagging sensation that you need to go again. That persistent feeling of incomplete emptying, like your bladder isn't truly empty despite your best efforts, can be more than just annoying or inconvenient. It can be a direct signal that your prostate is interfering with the normal function of your urinary system. For men over the age of 60, this feeling of incomplete bladder emptying is one of the most common and most frequently ignored symptoms of a prostate that may be enlarged or, in more serious cases, affected by cancer. Here's the underlying reason why this sensation occurs. As the prostate grows larger or becomes infiltrated with cancerous cells, it can exert pressure on the urethra, the tube responsible for carrying urine out of the body, restricting the normal outflow of urine. Your bladder then has to work harder than usual to push the urine through the blockage. Over time, this extra effort can weaken the bladder muscles, leading to that constant sensation that something was left behind, even after you've just urinated. You may find yourself needing to go to the bathroom more frequently, standing there longer each time, and still feeling unsatisfied and incomplete once you're finished. This symptom tends to sneak up on you slowly, and because it doesn't typically cause any pain, many men simply dismiss it as a minor inconvenience. But over time, it can lead to more serious problems, such as bladder infections, kidney strain, and even permanent damage to your urinary system. And in the context of prostate cancer, it can be one of the earliest, yet most easily overlooked, signs that something serious is taking place within your body. If this scenario sounds familiar to you, please don't ignore it. Your body is communicating with you clearly, calmly, and urgently. And now that you've heard all 8 of these critical symptoms of prostate cancer, you might be wondering, what should I actually do next? What steps can I take to protect my health and well-being? Well, in just a moment, I'll walk you through exactly how to take action and potentially save your life. By now, you've heard about the 8 most critical symptoms of prostate cancer: frequent urination at night, a weak or interrupted urine stream, burning or pain during urination or ejaculation, blood in your urine or semen, difficulty with erections, pressure or pain in your back or hips, unexplained weight loss and fatigue, and that lingering feeling of not fully emptying your bladder. Individually, each of these symptoms may seem relatively minor, perhaps just annoying or inconvenient, and easily explained away as a normal part of aging. But when considered together, they form a pattern that no man should ignore, especially not a man over the age of 60. I've personally seen far too many patients come to me after months, or even years, of brushing off these seemingly insignificant signs, only to discover that the cancer had already spread beyond the prostate, significantly limiting their treatment options. And conversely, I've also witnessed the profound relief and renewed hope in men who caught the cancer early, who took these symptoms seriously, and who acted quickly to seek medical attention. You see, prostate cancer doesn't always announce its presence with loud, obvious alarms. It often whispers, sending quiet, persistent signals that something's not quite right. That's why awareness of these subtle symptoms is so incredibly powerful. It gives you the chance to take control of your health before the disease takes control of you. So, here's what I strongly urge you to do. If any of these symptoms sound familiar to you, even just one of them, please don't wait or delay seeking medical advice. Make an appointment with your doctor as soon as possible. Ask for a prostate-specific antigen (PSA) test, a simple blood test that can help detect early signs of prostate cancer. Have that conversation with your doctor, even if it feels uncomfortable or embarrassing to discuss these personal issues. Your life, your energy, your future well-being may very well depend on it. And even if you're currently symptom-free, please stay informed, stay proactive about your health, and take good care of your body. Because when it comes to prostate cancer, early detection and prompt action are absolutely everything. Your body is constantly talking to you, sending you signals about its health. The question now is, are you truly listening?